Every step hurts. My knees ache. Nothing seems to ease the pain. These are the words of James, one of 110 million patients in the US alone suffering from knee osteoarthritis. Cell therapies delivered through a small bore needle, such as stem cell injections, offer a great promise for treating knee osteoarthritis. Beyond this application, cell therapies are being explored in more than 3,000 clinical trials for neurological, cardiovascular diseases, and more. Meaning there is a lot of interest in cell therapies. The problem is, most of these cells do not survive the injection. This means repeated procedures, higher costs, and yet more patient discomfort. Our team at Imperial College is the first to identify the fluid mechanical criteria required for keeping those cells alive when passing through the needle. We're developing the VIA injector. We predict it will increase acute cell viability from 50 to 85%. We have a strong proof of concept and a filed patent. Now we're raising £1 million to complete preclinical validation and prepare for human studies. Join us in making cell therapies effective for James and millions like him. Let's not just manage their pain. Let's transform their lives. Thank you.
So what kind of cell types are you targeting initially? And also, the innovation that you have, how do they differ from the current surgical approaches like catheter-based systems for delivery of, say, cell therapy products?
Thank you for the question. So currently we are performing experiments using HUVEC cells, which are human umbilical vein cord cells. They are most commonly tested for testing the efficacy and cell viability of them. If you're asking in terms of what cells we're planning to use once the device is on the market, that will depend on the companies which work on creating the actual cell therapies, who we're planning to sell the device on later on.
What is your initial core patient target segment, and how big is that?
So the device has various applications. Primarily, we decided to target knee osteoarthritis because it's a beachhead application. It doesn't require any injection into critical organs such as heart or brain. And that's a big market. As I mentioned, it's around 110 million adults just in the US. They're divided into two categories, which would have symptomatic and radiological cases. That way we can interfere with patients who are either about to have steroid treatment or patients who are about to have a total knee replacement, and we would prevent them from having that. Thank you.